Hi, I'm Dr. Medeiros, and welcome to Thrive Adult Primary Care. So the question for today is sort of a spin-off from the first video. I'd say we could all agree that what we fundamentally want is health, but it still begs the question, doesn't having good health insurance and healthcare help to ensure that I have that better health? That's what we're led to believe. I'm not sure that's exactly the case, but let's start with a basic review and then take it from there. Let me start by reviewing again that health insurance, healthcare, and health are related, but they're not quite the same. So health insurance plays an important but limited role. Healthcare comes from providers, and there are distinct advantages to going direct because our goal is to have health. Now let's go back for a moment to vehicle ownership and automobile insurance. I'd like to draw an analogy about the impact of high quality insurance on health. Let's say this driver has a titanium level insurance policy. It covers everything, even self-inflicted damage. So that means the driver can put scratches and dents, even leave the cigarette burning in the car seat, and repairs for all of this damage would be covered. A mentality starts to develop of, I can do whatever to this car, it's covered. So great, you may have this really gold star insurance policy. Congratulations. But now your car's a piece of junk because there's less motivation to maintain it if you assume any damage that's done will be covered and addressed by this system. Now let's say, for example, the policy is so comprehensive that regardless of the damage done to the vehicle, even if it's self-inflicted, when this driver decides that the car is too beat up, want to move on, the driver can actually trade it in for a new car at the expense of the insurance company. Now, that's good insurance, right? Well, guess what? That's where the analogies end, because you may be able to do this with a car. It doesn't work with your body. You only get one. If we expect insurance to cover anything and everything that goes wrong with our bodies, anytime we figure it's time to get it serviced, it may tend to demotivate us from the preventive habits that will actually keep things in good shape on our own. And we find ourselves perhaps making some bad decisions, like smoking, or partying all the time, eating breakfast at Dunkin' Donuts every day, or spending a ton of time sitting on the couch because you're tired. Meanwhile, if you're going to maintain good habits along the way, where does guidance come from? Does it come from the insurance company? Many of the good habits and the best resources for good health are free or come at the cost of a low, reasonable, out-of-pocket maintenance expense. But ultimately, in order to know how to maintain this excellent health, it helps to have guidance on what aspects of lifestyle can be practiced safely despite whatever conditions you might have. That guidance doesn't come from the insurance company. It comes from a relationship with a provider who is able to invest their time and energy into maintaining your health, rather than worrying about what the insurance company might funnel through to them, which is why it makes the most sense to maintain that relationship directly, just like you have a direct relationship with all the other things that are instrumental to maintaining good health. So this is a basic picture of why I'm doing direct primary care. The goal of a personal, direct relationship is to bring education into the care plan. So the group of videos that are going to be coming out next are the ones that excite me the most. We're going to talk about what it means to thrive, not just live more years, but to put more life into your years, to live life to the fullest. If you like this video, please do whatever you do down here, like it, share it, comment, subscribe to the YouTube channel, Putting the Patient Back in the Driver's Seat, and definitely come back and see what's coming up ahead. In the meantime, stay well.